I'll give an update on our case counts. So in the city of Richmond, we have 201 confirmed COVID-19 cases and 9 deaths. And in Henrico County, that number is 532 confirmed cases and 74 deaths. A quick breakdown, we've been talking about our efforts to really try to manually go and track down individuals and figure out some of those missing data elements, particularly around race and ethnicity. And so let me give you some updates on where we are with those numbers. In the city of Richmond, our percentage of African American are up to 64%. Our white population is at 24.7%, and then a little over 6% in the other, 4% in the other category and 6% in the unknown. So there's about 6% that we either haven't returned our phone calls or we haven't been able to track down phone numbers for. On the county side, the Henrico numbers look to be about 50% African American, 36.9% white, just under 4% other, and 9% unknown. So our staff has really tried hard to get after that information, and we still have some work to do, but we've gone a long way from having 25% unreported race data. I'll break down the deaths for you all. In the city of Richmond, our 9 deaths are 100% African American. Every one of those individuals has been an African American elderly individual who's lost their lives. And then in Henrico County, of those 74 folks, 44.6% African American, 45.9% white, 4% just under 4% other, and about 4% unknown. So that's what our data is looking like right now, and I think what is immediately obvious is that the data tells us that African Americans are carrying a higher burden of disease than their counterparts. And as we've talked about, it's not surprising. It continues to be frustrating and heartbreaking, but it is indicative of the underlying health disparities that we have known about for a long time. So what can be done, or how does this inform our efforts? How does this help us direct more of our education, our prevention, and our testing? Well, I'll start by saying that what we know about our Black and brown communities is that because they have faced so much adversity so consistently, historically, they've shown a tremendous amount of resiliency, even in the midst of COVID-19, and that when we talk to these residents, when we see who's actually out there helping our society continue, who's working on the front lines, who's working in essential businesses, there's a disproportionate share of low-income minorities who don't have the benefit of being able to telework or to work from behind a computer. But it continues to be challenging. So what are we doing about this as it relates to testing? So one of the big, I shared with this a few days ago, and we've continued to work with our partners at the state and with VCU to expand testing opportunities. Where this additional capacity will really come to help us is in trying to do more widespread testing with a rapid turnaround in our long-term care facilities, and VCU will be processing a lot of those labs, and that allows the state to open up its capacity, the state lab, to be able to process testing for the uninsured. And so as soon as Tuesday of next week, our team with the Richmond and Henrico Health Department will be circulating throughout a number of predominantly minority communities. We've developed a screening process where individuals will call our hotline, be screened for symptoms, be screened for insurance, and then assigned an appointment. We are not at this time announcing where those sites are on which day. We've talked before about where they generally will be in our public housing communities, some of our larger neighborhoods like St. Luke and Henrico Arms and Henrico. But as this kind of thing, walk-up testing around COVID-19 has not been done very much throughout the country. We found a few examples in San Francisco, in Camden, New Jersey, and in Washington, D.C. And so our team has been in conversation with those looking at the reporting. And so a couple of the things that we've had to put in place, one, to manage the crowds that may be coming. Two, to ensure that the folks who need this testing most will be able to get it. And when I talk about the crowds, I don't necessarily mean from a crowd control standpoint, but really from a standpoint that we can maintain physical distancing, right? You all may remember from the beginning of this pandemic when people were coming through the airports and in hordes, and they were in lines waiting to be screened if they had symptoms or not. And we really want to avoid situations like that where we have 400 individuals who show up at a testing site and can't maintain that physical distancing. And so we're really trying to be thoughtful about the process, make sure the individuals who need access to this testing most get it, and make sure we maintain an environment where we're not actually contributing to the spread of COVID-19. So that first testing event will be on Tuesday. We will announce, in 24 hours prior to that. Everyone should just call our hotline number, 205-3501. 205-3501, and they will walk you through the process to get screened and have an appointment established for those testing sites. Really a huge thanks to both VCU and to the state lab for making that possible. And again, we are actively recruiting testing teams. So if you are a healthcare provider who wants to be involved in actually being in a long-term care facility or out in one of these neighborhood testing sites, call your local health department or go to our website, www.rchd.com, and find the Medical Reserve Corps pathway. It's pretty easy. We can get you signed up as a volunteer. It'll cover all your liability issues, and we'll able to train and deploy you on one of these testing teams.